for more on this, let's speak to Dr. Emanuele Capobianco, who joins us from Geneva, and he is the head of the health and care at the International Federation of the Red Cross and Red Crescent. Great to have you on the News Hour. Oof, Italy, a lot happening there. You know the country. Do you think it can cope, the infrastructure can cope with this coronavirus outbreak and 16 million people quarantined?
Well, what we are seeing in Italy is a very difficult situation that we witnessed just a month ago in a country like China. China went over it and managed to to change the curve of the epidemic and bringing down the cases to very few nowadays. Italy is putting in place very severe measures that have the ambition to reduce transmission, to make sure that less cases emerge. And the big problem here is for hospitals, making sure that the hospitals are able to manage the huge increase of cases that has been coming over the past 2 weeks.
And do you think they can? Exactly. They're managing now, but can they?
Well, it all depends whether the numbers will go up. The system is clearly stretched. And let me tell you, I'm Italian. The system is a pretty good system, particularly in the northern regions of Lombardy, is one of the best and most productive and most efficient regions in the country. And I have plenty of doctors' friends at the moment. They are struggling. They are asking anyone to stay at home, not to go out, reduce the mingling, because that is what brings new infection and new people sick to the emergency rooms. And there is not much space left in those emergency rooms in northern Italy.
And Dr. Emanuele, just to quote Antonio Pezzenti, chief of the Lombardy Regional Crisis Response, he said, the Lombardy region that you mentioned, one of the best health systems in the world, is a step away from collapse.
Well, as I said, it is unprecedented what is happening in Italy. I think what is important for everyone listening from outside Italy is prepare, because this may come your way. And so we need to prepare health systems wherever they are in every country to potentially expand the capacity of emergency, but particularly of intensive care unit. There's a huge demand on those intensive care unit beds. They are very precious nowadays.
Very precious indeed. What about the rest of Europe? I'm thinking also the UK, the national health system. Can other countries cope?
Let me be frank. I don't think any system can cope with a huge increase and rapid increase of cases. But what we do have in our hands is the opportunity to have a slower increase in cases if the proper measures are put in place in time. And this is what is in Italy right now, is closing schools, blocking restaurants, closing museums. We have weddings and even funerals that have been suspended. It's basically we have a quarter of the country in lockdown. It's a very difficult for the people that are in the country, but this is what worked in China. This is what is being attempted in Italy. This is what may be coming for other countries that will have to face this terrible virus.
Dr. Emanuele, so today, given what we're seeing in China, is that really a sign of hope?
Well, we do have signs of hope from China. We do have signs of hope from Singapore that also was able to contain the outbreak. We are seeing some positive signs from South Korea. This is an enemy that we can fight and win, but it will take time and will take a lot of sacrifices, particularly from the people who are working in the health system, doctors, nurses, but sacrifices also from the common people that will have potentially to change their way of lives for a few weeks, potentially months, in order to make sure that we don't lose precious lives due to this outbreak. So we are all in it together. There is a sense of individual responsibility that is absolutely critical, and of global solidarity that needs to emerge. And that's what the Red Cross is really pushing, to make sure that everyone is aware of its own responsibility and tries to contribute to stop the spreading of the virus in its own community, but then in his own country, and eventually to the entire globe.
This is an enemy that we can fight and win. I will remember that. Dr. Emanuele, thank you so much for speaking to us on the news hour. Dr. Emanuele Capobianco, thank you.